radial collateral ligament complex. Okay, we'll be focusing on the anatomy. Okay. As the term suggests, obviously it will be providing varus stability, or you can say it provides limitation to the varus stress. Okay. So we start with the radial collateral ligament. So all of these ligaments, they are best seen in coronal images. But if you talk about the LUCL, because it is obliquely oriented, so it is best seen on coronal oblique images, which are angled 20 degrees posteriorly. Okay. While radial collateral ligament is seen on neutral coronal images also. It's obviously, since it's a ligament, so it's a homogeneously low signal density structures coursing onto the anterolateral aspect of the humerus. So let us see. So we have the coronal T2-weighted image, parts of test. Okay. So this is a vertically oriented radial collateral ligament. How will you differentiate whether it is RCL or LUCL? Because both have the same origin, and sometimes what happens is the origin of the lateral extensor tendon or the common extensor tendon, the radial collateral ligament, and the lateral ulnar collateral ligament, the origin you are not able to differentiate. Okay, so you start by seeing the or differentiate by the insertions. The radial collateral ligament will insert onto the radius itself. Okay, while LUCL, as we move on to the posterior slices, what you will see that it will start to curve around the head of the radius and will attach onto the ulna. Okay. This is radial collateral ligament. This is the pathway of lateral ulnar collateral ligament. And if I talk about this is your common extensor tendon origin. Okay. So even if you're not able to differentiate the origins of these three structures at the lateral epicondyle, okay, but by seeing where they are going, you can easily differentiate whether it's a radial collateral ligament or the lateral ulnar collateral ligament. Okay. Again, you can see the vertically oriented structure, low signal density structure, which is originating from the lateral epicondyle and attaching onto the radius, that is your radial collateral ligament. Okay. Annular ligament, very simple. It will obviously be surrounding the radial head. So it's a primary stabilizer of the proximal radial joint. Obviously, it will be best seen on axial images. It's very simple. There are actually no pathologies of the annular ligament as such, so it's not very important from the pathology point of view. The important here is are your radial collateral and your lateral ulnar collateral ligaments. So as these LUCL and RCL, they descend. Okay, that is a part of your pediatric disorders. Okay, so radial head subluxation in pediatric age group, that we call it as the nurseman's elbow. Okay, but in adults, if you try to look at the spectrum of trauma in adult patients, you will never find a tear of the annular ligament. Okay, even if the elbow is completely dislocated. Okay, suppose there's a tear of the LUCL. Okay, so initially what happens is the lateral side is obviously weaker as compared to the medial side. So the first tear which happens is that of the LUCL, which is followed by basically your anterior and posterior capsule, and in extreme dislocations, your ulnar collateral ligament tears. But in all of these dislocations, your one annular ligament remains stable. Okay, so you will always see that the ulna and the radius are going side by side. Okay, ulna will rotate on its long axis, basically increasing your ulnar humeral distance. So it will take the radius also along with that. Okay, so in the context of adult traumatic injuries, including the ligaments of the elbow joint, you will never find a tear of the annular ligament. Okay. This is different, obviously, in the pediatric population that we'll be covering in the next class. Okay, that was my point. Okay, now since the LUCL ligament, as I told you, is going obviously is going towards the radial head, it will take a turn from behind the radial head and then attach onto the ulna. So what I want to say that at this level where we have the proximal radial ulnar joint, we see the annular ligament. Sometimes the LUCL is indistinguishable from the annular ligament. You're not able to, you will, while you're tracing down the LUCL in axial images, you will not be able to differentiate from the annular ligament. Okay. So the best images for LUCL, if somebody asks you, they are your 20-degree posteriorly tilted coronal oblique images. Although we do not take these images specifically unless until we are suspecting a LUCL tear. Okay, so it is preferred that you take coronal oblique images instead of true coronal images. Okay. The most important radial collateral ligament complex is your lateral collateral ligament. Okay. So it is the most posterior most origin from the lateral epicondyle. Okay. So this I want to tell you. Suppose this is the lateral epicondyle. This is your anterior portion, and this is your posterior part. So I'm looking from the end face in the sag view. Okay. So what I will see that the most anterior most and superior most origin will be of the common extensor tendon. Behind that and posteriorly and inferiorly will be your radial collateral ligament. And from the most posterior inferior part will be your lateral ulnar collateral ligament. Okay. But I've told you at the origin, in among 1.5 Tesla images, you will not be able to differentiate the origins of these three structures. Only by seeing where these three structures are going, that you will be able to differentiate that which of these is which. So this is your distal humerus. Okay. So I'm looking from the sag view, end face, the lateral collateral ligament, the lateral epicondyle region. Okay. So it is said that the superior most and anterior most. Suppose I'm scrolling your uh, coronal images. Okay, so I'm starting from the anterior most coronal image of the lateral epicondyle. So the first thing which I'll be looking at is your common extensor tendon origin. Okay, so these are your coronal sections. Okay, I am looking from this side. Okay, so what the first thing which I'll see will be your common extensor tendon origin. Next will be your origin of the radial collateral ligament, and the third will be your origin of the lateral ulnar collateral ligament. Okay. So you will say that from the posterior inferior part of the lateral epicondyles. Okay. So if you're looking at the coronal section, so in the anterior sections you will find these two, and in the posterior sections, while you're scrolling posterior, you will find the origin of this. But it's usually not able. 1.5 Tesla images you will not be able to differentiate the origin. Okay. So the name ulnar has been given because it inserts on the ulna by going behind the radial head. Okay. Coronal and coronal oblique images are best for evaluating these. Okay. So this is how. So this is the posterior most section. You will see that the radial head has almost ended now. Now we are in the section which is behind the radial head. Okay. So what we see is that from the posterior inferior part there is a hypointense structure which is rising going around the radial head, and this is inserting onto the ulna. If you want to learn that what is the structure on which it inserts, is your crista supinatoris. Okay, but no need to remember. Just remember that it's inserting onto the ulna. Okay. So this is a coronal titubated image. This is obliquely oriented. That is why you are able to see whole of this LUCL in a single image. Otherwise, you will have to move multiple sections so as to see if these are if you're having true coronal images. Okay, so that is why the coronal oblique images they are preferred for LUCL, and the angle of tilting is 20 degrees. Okay, so I've already told you these three structures are frequently inseparable as discrete structures. If you are taking the seeing the MRI images at the level of origin, that is your lateral epicondyle. If you're taking true coronal images, so if you're taking true coronal images, you will not be seeing the LUCL in a single section. Obviously, you will be requiring sequential images. But if you're taking coronal obliques, obviously you can see whole of the LUCL in a single plane. Okay. And coronal oblique images, they are taken posteriorly angled approximately 20 degrees in relation to the humeral shaft. And important point, obviously the elbow has to be kept in the extended state. Now these are certain images which are showing you the normal appearance of the structures which are at the common extensor, the lateral epicondyle. Okay. There's a appearance which we call it as the normal bilaminar appearance because a strip of fat is present between the origin of the LUCL and the lateral ulnar collateral ligament. Okay, but you may or may not find this normal bilaminar appearance. Okay, that is just one of the things. Sometimes they can be inseparable also. Like this, in this image, you are not able to differentiate where the common extensor tendon is and where the origin of LUCL is. This is a coronal oblique image that obviously has the advantage of demonstrating the LUCL's complete length in a single image. Okay, so these are the proximal and distal segments. The blue ones are the proximal segments, and the red ones are the distal segments of LUCL. So these are some sequential images which I'm now trying to show you to basically make you understand the anatomy once again. Okay, so this is your common extensor tendon origin, and this is your LUCL, which is right beneath it. As we move on to the sequential images, we see that the common extensor tendon has gone laterally now, but the LUCL is arching more posteriorly such that it is going behind the radial head, coursing towards the crista supinatoris and inserting onto the ulna. So it's basically it sweeps around the radial head. So that is how you recognize it. So these are the images. So as we move from anterior sections to more of posterior sections, what you can see is that the green thing is here is basically your common extensor tendon, and the blue one here is your lateral ulnar collateral ligament complex. So if you see, if you move from anterior to posterior, the bulk of the origin of LUCL keeps on increasing. Okay. So as anteriorly, you'll see that very few fibers of LUCL you are able to visualize. Most of the fibers are of common extensor tendon origin. Okay. So as you start moving posteriorly, this triangular area keeps on increasing. Okay. And a very minimal part of common extensor tendon origin remains. Again, this is best seen on 3 Tesla images. So that was all about your radial collateral ligament complex.